Hello everyone, I'm Dr. Scholastica Ezeribe, your facilitator for EGC A04, Techniques of Counseling. Today we are taking a lesson on systematic desensitization. Systematic desensitization is a counseling technique derived from the behavioral therapy. And today we're going to look at what systematic desensitization means, the steps involved in the use of systematic desensitization. And I believe by the end of the lesson, you will be very happy because you will have been equipped enough to help your students or your clients or your neighbors or whosoever around you that has the problem of phobia. So sit back and enjoy the lesson. Thank you very much. Yes, the code is EGC 804 and the title is Techniques of Counseling. Our topic for today, like I told you, is systematic desensitization. And taking this topic, what do we gain to do? What do we stand to gain? And that is our intended learning outcomes. By the end of the lesson, the students will be able to explain the meaning of systematic desensitization. We will be able to discuss the stages involved in systematic desensitization. We will also be able to help clients overcome irrational fears and anxiety that has resulted in maladaptive behaviors through systematic desensitization. Now, we go to the meaning of systematic desensitization. What is systematic desensitization? Systematic desensitization simply means is a counseling technique. It's one of the numerous counseling techniques. We've been talking about counseling techniques in our last lessons. Today, we are looking at this counseling technique called systematic desensitization. It is derived from the behavioral counseling theory based on the principle of classical conditioning. It is also known as graduated exposure therapy. So, when you hear about graduated exposure therapy, you know that we are talking about systematic desensitization. It is used in the treatment of debilitating anxiety or phobia over some events and situations which causes unadaptive avoidance behavior. You know that most of us can be very fearful about some things. We have irrational fears. Some people fear dogs, some people fear snakes, some people fear heights, some people fear closed places. There are so many types of fears, and that's irrational ones that becomes disturbing. When you fear a dog and the mention of a dog gets you into trouble, you are afraid, you hear that there is a dog in that house, you can never pass through that way again. That is a debilitating fear. It is now called phobia. It is not the normal fear. An example of this kind of phobia or anxiety provoking situation is a fear of tall story buildings. We know that some people are afraid of heights. They cannot live in upstairs. They can't live in story buildings. When you take them, they won't even have anything to do with you if you are their friend and you are living in a 2 or 3 story building. Just know that he or she will not visit you because he is afraid to climb stairs. He is afraid of tall buildings. So, we continue with the meaning of systematic desensitization. And we say the systematic desensitization involves instructional plan with intentional and purposeful sequence from simple to complex in order to gradually effect behavior change or mood. We said it is a graduated exposure. We look at this picture here, the way it goes. You see from this small one here, you follow the arrow, it gets to the bigger one, then to the bigger one, to the bigger one, and to the biggest one. That is the way systematic desensitization works. When you are applying it, you start from the lowest fear-provoking stimuli, and then you get to the higher one, and then you graduate it in that way until the fear is overcome. That is why it is called graduated exposure therapy. In working with this systematic desensitization, using this technique, it combines relaxation techniques with graduated exposure. Just like in this picture now, the exposure to the fear-provoking stimuli or the fear-evoking stimuli is graduated, is put in such a way that one comes after the other. Maybe if I hear dog now, I get afraid, but not so afraid. And then if I walk towards the place it is, I get more afraid. You just, in trying to use the technique to overcome that fear, you do it in a gradual way, one step at a time, starting from the simple one to the complex. So that is, starting from the one that is mild in provoking fear to the next one, to the next one, then to the main thing. So in trying to do this, you use relaxation techniques. Relax the individual before you go on to the main exposure. And in the next slide, we are going to take our activity 1. So far, we have done something, so we are going to look at our activity 1. In this activity, in 1 minute now, let's take 1 minute only to answer these questions. Which of the counseling theories is systematic desensitization? It is desensitization derived from. What is systematic desensitization also called? We have talked about these things, so you should be able to do this activity. Just 1 minute. Come back. Then we go to the next stage, and that is the stages of systematic desensitization. What do I mean by the stages of systematic desensitization? This means the way we have said that this is a graduated exposure. Now, the way you graduate the exposure, the way you do the thing, you get somebody out of fear using systematic desensitization, one after the other, or the one you do first to the next one, to the next one, to the next one. And these are these stages or the steps involved. And so we have 4 stages or 4 steps involved in systematic desensitization. Now, stage 1 is this. When you build a hierarchy, or you build or construct a hierarchy of client's anxiety arousing stimuli from the mildest to the most anxiety evoking stimuli, just like I said before when I was talking about the graduated exposure. Now you build a hierarchy, you compare, you say, what is this thing? We talked about fear of tall buildings. What is the problem? When you see a tall building, your mind will just jump, and then getting closer to it, you are afraid, you become more afraid. Then when you enter to the ground floor, you are afraid, but it's not so much. Then you start climbing the first one. The first floor gives you trouble, but you can manage the second one. But after the second one, you cannot. When you are told to get to the third floor, it is like you are going to die. It is like you are going to, just die. The thing you become so afraid that you'll be shaking, you will not even dare it. So when we are talking about these stages of systematic desensitization, we are talking about the graduation now. The graduation, how is it built? How is the anxiety provoking stimuli arranged? You arrange them. Which one comes before the other? Which one is the mildest? Which one is the strongest? Which one makes the person very, very anxious? Which one creates the most fear in that person? So you arrange the client's arousing stimuli from the first one, that is the mildest, to the most evoking anxiety stimuli. For instance, if we look at this ladder now, this is a kind of ladder hierarchy. We start from the lowest one here. Assuming it's 20%, the level of anxiety there is 20%. Then you climb to the next ladder is 40%. The next ladder is 45. The next is 55, 60, 80, 100. So as you are arranging the stimuli, you arrange it from 20 to 100, which is the highest, 20 being the lowest. As you arrange it like that, you are now ready. That is the stage one. That's the first thing to know. Now you know the fear evoking stimuli. You know that thing which the client is afraid of. Now, as you know it, you come and arrange the hierarchy. You arrange it in hierarchy for the way the fear comes from the smallest to the biggest. As you do this, you go stage, which is the stage 2, where relaxation technique is taught to the clients. Here, clients begin their treatment by relaxing the clients or teaching them to relax themselves. There are so many relaxation therapies, relaxation from techniques. You, as a counselor, should know these techniques. So, when you are trying to help the clients in challenging their phobia, you should make sure that they relax first, so that they don't get into trouble while you are trying to put them through the stages of this desensitization. So if you look at this picture here, you will see the couch, you see the client lying on it. This is the client lying on it now, and there the counselor is making him relax. He is so relaxed. When the person uses the relaxation techniques to relax, you make him relax. Then you can now get into the third stage. You tell the client imagination. You tell the clients to imagine the fear-provoking stimuli vividly with their eyes closed, starting from the milder ones. Then the desensitization process goes on gradually. You gradually expose the person, the client, to the fear arousing scenes through his imagination. Remember, at this point, he has not gone to the real place. He has not gone to the real life situation. You are still with the client in your office. But now he is relaxing in a couch. He has relaxed, and now after the relaxation, you make him or her to close her eyes. You look at this lady here. She is closing her eyes. Her eyes are closed, and she's relaxing, relaxing. The way she has relaxed, you can now, with her eyes closed, you can now begin to talk to her. You tell her, you the counselor, now will begin to tell her, you know, the mildest, having built your hierarchy of anxiety provoking stimuli, you now start from the lowest point, maybe the one that causes 20% fear or phobia. You try to put him through these stages, one after the other, one after the other, while on the couch here in your office. It's not on the place. Now, for instance, we are talking about tall buildings. You now say, okay, imagine yourself, you have come into a compound, and the compound has a 10-story building, and in fact we are going to the 10th floor. That is where we are going. That is where my or your teacher is, or whosoever you want to do, or whatever you want to pick is on the 10th floor. Now imagine yourself that now that we are in the compound, imagine yourself going to the ground floor. You have gone to the ground floor. Now begin to see what is happening to you there. Why? What is the fear much? And then you begin to desensitize the person. Let him be comfortable in his imagination on the first floor, on the ground floor, then take him to the second floor, the third floor, the fifth floor. In that way, while still on the couch in your office, with her eyes or his eyes closed. This proceeds gradually through intensity fear arousing scenes. And if we can there imagine the situation properly and try to overcome the fears while using his imagination, then you will take him now to the next stage, which is the confrontation of real life situation. The counselor encourages the client to confront the real life situation. Now you can see this picture here. This is a high or a tall building, a story like 8-story or 10-story, but you see it is a high building. Now you take the client to this situation, to this high building, for instance, because we are using fear of tall buildings here. These buildings are tall. You now come into the compound. The way you took the client through his or her imagination in the fear evoking essence, now you come real life. What you did in the he or she did in his imagination, stage 3, he will begin to repeat them here. And because he overcame, he is now conversant with this story building in his imagination. Now he can go through it here. For after a time, after a series of repetitions, he will be able to overcome the fear. And so through this systematic desensitization, the fear will go away. Next slide, we'll look at our class activity 2. So class activity 2, mention the stages of systematic desensitization in overcoming phobia in your clients. We have just described that, we've just discussed that. So I expect you to mention the stages of systematic desensitization in overcoming phobia in your clients. Now in this summary, in this lesson we have learnt the meaning of systematic desensitization. We have learnt another name for it. We have learnt its stages and how it works. So having known this, bring us to the end of this lesson on systematic desensitization. So I thank you for being part of this lesson and for listening, for enjoying the video. Thank you very much, and God bless you.